All right. Welcome, everyone. My name is Amy Warfield, and I'd like to talk to you today regarding balance work and fall prevention. First, thanks for taking the time to be here today. And I wanted to say thank you to the CMTA for offering this amazing session for all of us to learn from each other and bring so many resources together for everyone to benefit. A bit about me, I am a physical therapist in the Washington, D.C. area. I've been practicing for approximately 20 years, not in this geographic location specifically, but in several different places. I've worked in many different settings across the lifespan. Um, Personally, I have CMT type 1A within my family. My husband and his mom are affected, and at least two of our three children are affected. So every day we do our best to stay as active as possible and do the things that we all love to do. And I hope that today's talk will help inspire you to do the same. So as I started to kind of think about this, I wanted to look up in the Oxford Language Dictionary what our definition of balance is. And the noun definition states it's an even distribution of weight, enabling someone or something to remain upright and steady. And the second one was a condition in which different elements are equal or in the correct proportions. And thinking about a balance, for example, between work and relaxation, or from a PT standpoint, we might think about it as like the pull of a muscle on one side of a joint versus the other side of a joint. And we'll talk a little bit more about that as we move forward through today's talk. My objectives, and I hope that you walk away from today with a deeper understanding of the impact of falls, therefore, having you think about why it's so important that we think about this balance component. I'd like you to better understand the basics of balance. I hope that you understand how and why CMT impacts balance. I hope you can leave with an understanding of how a PT can help support you in living a healthy, active lifestyle. I'd like you to have 5 takeaways to help you or a loved one with CMT be safer today, tomorrow, and every day moving forward. And I hope that we have some time to have the opportunity for questions, and discussion might be tough depending on the size of our group, but I hope that we have a few minutes to all be able to learn from each other from our experiences. All right. So just to talk about the impact of falls with some data. Each year in the United States, from the CDC, more than 1 in 4 adults over the age of 65 will experience a fall, and half of them report it to their doctor, less than half. That said, when there's a gap or a lack of communication between the patient and the medical team, that becomes tough for the medical team to be able to best support. So we're going to talk about it later, but communication is very important, um, in relaying that information to our doctors and the medical team as a whole. In Per the National Safety Council in 2019, 6.8 million ED visits were as a result of a fall visit. By ED, I mean emergency department. That's a lot, right? Um, Falls can be costly and very serious. In 2015, the medical costs for falls exceeded $50 billion. And as our US baby boomer population continues to age, the number of fall injuries and medical costs will also continue to increase. We all know falls vary in severity from a skinned knee, an injured pride, to potentially a hip fracture, a traumatic brain injury, or more seriously, death. Um, and lastly, a fall once doubles your chance of falling again. And so being aware of what the circumstances were that led to the fall and really thinking that through is super important, and making sure that we're putting as much prevention in place as possible. Now, that data is for the older adult population, on its own. And when I dive deeper into looking for some CMT specific data, In 2017, there's a study by Rabdary et al. Titled The Frequency and Circumstances for People with Charcot-Marie-Tooth, a cross-sectional survey. Um, and falls and near falls were reported by 86% of the survey correspondents. And so thankfully, the majority of falls occurred at home and were just moderate and minor injuries. Um, and most were scrapes and bruises, and people were feeling shaken by the experience, as I'm sure you can relate if you're listening to this today. Then you go to the other side of the age spectrum. In 2018, a study of children affected by CMT were compared to their typically developing child over a period of 6 months. And the conclusion, as you might imagine, and not likely be surprised by this conclusion, children and adults with CMT fall more often and sustain more injuries when they fall than their typically developing peers. I think as we go through today's talk, you're going to have an understanding, and likely you do already personally, of why this happens based upon our neurological systems. So an understanding of the components that make up your sense of balance and basic physiology will help you to understand how you can work together to prevent a fall. Hence, I'm taking you to Balance Class 101. Our balance system is complicated. It involves the eyes, the joints, the muscles, the inner ear, and our brain. Balance involves reception and organization of sensory inputs coming from different directions and the planning and execution of specific movements to achieve that upright posture. We have both reactive and predictive balance control as part of our neurological systems to help us maintain upright function. The combination of sensory inputs being impaired, perhaps muscles being weak or imbalanced surrounding the ankle and foot, and potential foot deformities, makes balance particularly challenging for those that we know, love, and might even be affected by CMT. Now, let's talk about each of these systems forming this triangle that you see on the bottom of the screen. We have vision on one side. Visual input is essential for implementing avoidance strategies, critical for proactive movements as you move through your day. Now, vision itself might not necessarily be impacted by CMT, but as we age, we need to think about challenges with vision, or if there's just a visual challenge at baseline. Thinking about, some of our children that are affected, maybe they were born with visual challenge, and that needs to be taken into account. Think about, what is our depth perception like? What can we see the obstacles coming at us and plan accordingly in terms of reacting to that? Going to the bottom of the triangle, you see somatosensory. Our sensory systems are providing a lot of feedback as we work with our bodies to stay upright throughout the day. So if you think about the feedback that you feel through your foot as you're standing on a hardwood floor is different than if you're standing in your backyard, for example. The feedback that you get through your foot if you're walking on ice and your gait pattern will be very different than if you're just walking on the pavement on a summer day, or if you're standing in a field. Think about the unevenness that you might feel and how you might be a little bit more cautious with your gait pattern and with your movements because of the ground being uneven underneath your feet. Your vestibular system is one that people might not be as familiar with. And it's the system within our inner ear. It's a complex system of bone and cartilage. We've got semicircular canals filled with fluid and gravity-sensitive crystals that help relay the message to the brain in terms of if our body is accelerating through space, if we're turning a corner, and those sorts of input. So that really, if people have something, the crystals get a little bit out of place maybe, they can struggle with, significant sensations of dizziness, and that can seriously impact someone's balance. Also to consider amongst this bigger picture is, what does the muscle strength look like? What does our range of motion look like at each joint? What's our reaction time like? What daily environments are you spending time in? We're not just at our home, generally speaking. People might be out and about in terms of their occupation or their recreational activities. And so, what do those environments look like? And also to consider, what is our basis support like? The basis support we're going to talk about a little bit more. And that's kind of where, for example, this person who is walking on the ice has these trekking poles. He has a dramatically bigger basis support, as you're going to see in a few minutes, than if he were just on his feet, because he has increased that space underneath him. I found this schematic on a site called Seattle Dizzy Group. They had a lot of great balance resources, and I thought it was a great representation of the three systems integrating into our systems. And so you can kind of get an idea. The purple represents proprioception, or that somatosensory feedback. We use these words proprioception and kinesthesia within the PT domain. Proprioception is, where is our body positioned in space? And kinesthesia is, where is our body positioned in space as we're moving? But if you think about that, we're getting feedback from our joints, from our muscles, from our skin, and then it's integrating into our brain. And what are we doing with that information? Maybe standing up, turning our head, bending over. And that all helps us, that's part of the system of balance. Then we have the visual piece. Is our eye coordination on target? Are we getting a sense of light and color and getting that depth perception, that spatial awareness? And again, that feedback goes into the brain. And what are we doing with it? Are we able to stabilize our gaze? Are we able to have that ability to realize, that there's a curb in front of us, and how big is that curb and what do we need to do with it? And that goes back to depth perception. And then you think about the feedback that you get from the vestibular system. You see, is there rotational movement involved? Is there lineal movement involved? And how does that impact our equilibrium? So I thought that was a nice schematic in terms of putting those systems all together. If we go back to that triangle, if someone comes to us in the PT clinic with a lack of sensation throughout the bottom of their feet, we're going to really try to help the other two sides of the triangle to maximize the potential in terms of their balance. So we're going to ask vision and vestibular to really kind of step up their game, and we're going to challenge that a little bit. So for vision, I'm going to really educate and recommend to that person that it's important to turn on the lights when they get up to go to the bathroom in the middle of the night, because their body's really reliant upon their sense of vision to keep their body upright and stable, because they don't have access to the bottom side of the triangle as much as we would like them to. And the same goes for if any of the other areas of the triangle were impacted. So I hope that that makes sense. And again, if someone is born with a vision deficit, likely their body has compensated by having the vestibular system, the somatosensory system working as hard as possible to try to help keep them upright. Okay, so we talked about basis support, and the basis support is defined by the perimeter of points of contact with the support surface. So it's kind of a continuum in these three diagrams, A, B, and C, where A has a very narrow basis support and it progresses to a wider basis support. That blue dot, I would envision that to be a cane or a Lofgren crutch, like a forearm crutch, or something similar to that. Now, if you think about it, we can alter our basis support with the position that our feet are in. We can alter our basis support with incorporating an assistive device. Someone we're using, say, a walker, and it's got 4 points of contact. You can imagine that, for example, the diagram of C right there would be even larger, right? Because it has 4 points of contact from the legs of the walker right there. Now, I have a short video. This is a family member of mine, and she's going to start with a very narrow basis support. I want you to look at her feet and how hard she's trying to keep her balance here. And she's going to progress to a wider basis support. If it's someone, for example, in a soccer goalie, they're going to have that wide basis support with a low center of mass to try to make themselves as stable as possible. So let's watch this. It's just a quick 45-second video.
Okay, so feet are right in line with each other. Muscles are working to help her keep her balance. A slight tap on the shoulder. No. That's okay. Okay, now move your feet so your side. There you go. Okay, so she's still got a pretty narrow base of support. I'm going to give you a slight tap. Just work a little bit more. Okay, wider feet. So a little more stable there. Now go very wide. So much wider base of support. Give her a tap, and she's super stable there. Okay, thank you very much.
Okay, so then moving on to our balance strategies. In the diagram that you see, the person is standing solidly on the left. Moving forward, he gets what we call a balance perturbation or a little knockoff balance. It might be, a nudge from behind, a person on the metro that bumped him with their backpack, and he's able to use a fixed support strategy, such as an ankle strategy, to keep his body upright. He doesn't really have to make a whole lot of adjustments. It's just the ankle muscles reacting and shifting him back to an upright posture. If he gets a little larger balance perturbation, hence the little larger blue arrow there, he might have to engage his ankles and his hips to try to keep his body upright, or maybe just the hips by themselves, depending on how his body reacts. But he still didn't actually move his feet, so hence the name fixed support strategy. If you get a larger balance perturbation still, or knock off of balance, you might have to use something called a change in support strategy or a stepping strategy. It might be one step, it might be more than one step to help the person maintain upright. So again, this perhaps was a family member of mine. Yeah. So that was an ankle strategy. That was an ankle and hip. That's what we call a stepping strategy. All right. So you can see the larger the balance perturbation, the more he had to work to keep his body upright. Yeah. Oops, sorry. Looks like I hit play. So that was an ankle. I had to move us along. Okay, so you're already surmising in your head, I would imagine, and you're absolutely right. How does having CMT fit into this picture? In a really significant way. We talked about balance, but there's muscle imbalances too. If our nerve is not able to get the message to the muscle to activate over time, and the muscle is getting atrophied on one side of a joint, the forces are not equal, right? And our bodies have to work hard to help them maintain upright and regain that balance. So we have in folks affected by CMT likely areas of muscle weakness and atrophy. As you know, if you're listening to this, CMT affects everyone differently. Even within the same family, the actual presentation of the person can be very different, even though the genetics might be very similar in terms of the CMT presentation. So we need to truly assess each person individually. So we addressed muscle weakness and muscle imbalance. Those can lead to joint changes over time and deformities. And that can make your base of support even more narrow. Um, if you have a very high arch, for example, you don't have a lot of foot contact with the ground then. And so that, narrows that base of support even further. Just with age, we might experience vision changes and or changes within the vestibular system. And we know that that's part of that triangle that helps you, really maintain that upright position. Often, folks might experience decreased sensation with their skin and therefore also decreased proprioception or kinesthesia, those bigger words that we used earlier that really say, where is our body in space? I tell my kiddos all the time that they need to be checking their skin and that they need to absolutely minimize the time that they're outside barefoot. They're teenagers and they love to just not think and go outside with whatever footwear they have. Um, but we're constantly trying to educate because without that lack of awareness, if there's a small pebble that gets into the shoe and creates a sore and they're not aware of it and they keep putting, that pressure on over and over again, They need to be checking their skin. They need to have footwear on just for their own protection of their skin. As we mentioned earlier, all persons have their own unique daily challenges and their own activities of living. So if you see a PT, those goals that are created and that plan of care will be individualized. So your PT session will not be the same as your neighbors or your person that you know who also has CMT, because it's not, the situation is not the same. So we want it to be individualized to meet your needs. So if you experience problems with balance, you know that balance problems make it hard to maintain a stable posture and stay upright. That standing in a crowd can seem more difficult than moving through that crowd. And why is that? Again, like, think about all of the stuff that your sensory system is impacted by when you're in that crowded setting, and other people moving and some people standing still, and that's a lot of visual feedback. So that makes it very difficult to just stay upright. If balance problems go untreated, they can lead to falls. So my hope is that if you see a physical therapist that can perform balance testing and develop a treatment plan specific to the challenges and goals that each person faces, that you can help improve your strength, your stability, and the movement. So what can a physical therapist do to help? We are trained as movement experts and as problem solvers. A physical therapist will listen to your story and try to find patterns. They'll evaluate the muscles, the joints, the inner ear, your eye tracking ability, skin sensation, proprioception, kinesthesia, circulation, all systems. We're going to inquire if an assistive device is being used for mobility. If so, is that assistive device the best option at this time given your situation? We're going to inquire, what is the history of your symptoms? How long has it been going on? Have you used orthotics in the past, and have they been helpful, or have they been even trialed? We're going to observe your mobility and test your balance. We want to know, what are the circumstances of any falls, if there have been any, and is there a fear of falling? All of this information will be put together to help us better understand the challenges that you're facing and to determine how to help. Strategies might be provided to reduce the fear of falling. Often, if someone just understands a little bit more about balance, they can make decisions that can help them to stay upright. The goal would be for us to help you decrease the fall risk and improve your overall mobility and movement skills. Improve your balance and your confidence. That all goes along with decreasing that risk of falls, right? And helping you learn how to move safely. We want to improve your strength with consideration of the overall medical picture. I say that, and I want to pause here. With CMT, some muscles are weak due to muscle atrophy over time, with the nervous system not being able to get the message to the muscle to activate it. That said, as a PT, if we try to strengthen that muscle, we can try and try and try, and we're not going to be able to get it stronger because we're not able to get the message down to the muscle. However, might we have muscles weak due to what we call disuse atrophy? In other words, perhaps someone has had more of a sedentary lifestyle and not been moving around as frequently, and therefore has weak muscles throughout the core or the proximal hips, meaning proximal meaning more close to the person's body. Those muscles, if they've got full innervation, namely the nervous system's able to talk to the musculoskeletal system to get it to activate, we can strengthen those muscles, and that will be super helpful when we talk about all those balance strategies we talked about earlier. Certainly, improving someone's flexibility and posture with respect to what does their range of motion look like and what does their balance look like, that will all help them with their balance. And our goal also would be to help you increase the overall activity level. Again, balance is something where, like, if we don't use it, we lose it over time. And so we want to avoid that more sedentary world and keep ourselves as active as possible. As you'll see in these pictures, if someone were to be working on balance in the clinic, You might look at these pictures and be like, but that is not what I do in my daily life. But the person with the ball, for example, might be working on those anticipatory postural reactions. The ball is rolling towards me. How am I going to react? I want to, make sure my body is stable to be able to lift up my foot to stop it. And that is applicable to, daily life challenges where you need to respond from an anticipatory perspective. The woman standing on the foam and looking up, this therapist is obviously altering the sensory feedback that she's getting through her feet. She's on a squishier surface now. And maybe she's going to try to give her a visual challenge at the same time. Maybe she's going to ask her to turn her head side to side. And then can she use the feedback that she gets to try to keep her balance? And again, we're working on the integration of all of those systems. And then you'll see the person in the picture up above off for a hike. It does look like this person has some trekking poles, maybe a brace on their right leg also. And again, is that challenging her balance? And is she out living and doing what she wants to do? Absolutely. She's, incorporating the help of some assistants to help her out. And that's so important because she's now able to get out there and do it. Okay. When you follow up with your PT might reach out and ask you to follow up with your medical doctor or your primary care doctor to review your medications and any interactions and just get an overall review of your health. You might be asked to follow up with your eye doctor to determine if there's any vision needs, with your ear doctor to assess if there's any inner ear or outer ear challenges, maybe with an orthotist to determine if your braces need an update. Orthotics take a beating over time, and they might not be providing the needed support that you need at this time. And any other relevant healthcare professionals for each unique situation. And again, we're not just trying to give you homework, we're trying to have the medical team see the full picture. So your support with that would be great. I found this on the CDC website, and I'd encourage all of us to take a look at it. Not just if you are over a certain age, but just all of us in terms of our overall safety. They have a checklist to find and fix hazards within your home. And it asks you things like, are there shoes and books or other objects that are on the stairs, for example? Do you handrails in the bathroom? Is it well lit? Is there a clear path to walk? In the bedroom, is there a lamp close to the bed so you can turn it on and increase that visual feedback? In the bathroom, if the floor is slippery, can we put down a non-slip rubber mat? Those sorts of things. It's a really awesome checklist to check out. And you can kind of go through that on your own and see, if I were to do this checklist, if I were a home care physical therapist and I walked into this home, what sorts of things? Are there throw rugs with the corner rolled up that I could modify just to kind of, simplify your daily life and minimize the tripping hazards? This is put out by Can Child. And as healthcare professionals, we're really taught to kind of look at things from a framework to best address every person's needs as they come in to see us. And this was set up with the mindset of, for our children who are affected by neurodisability in particular, we can't always fix the problem, but how do we help them engage in life as best as we possibly can to help them do everything that they want to do, recognizing that not one factor is more important than the other. But function refers to what people do. Family represents that essential environment for all children. Fitness is how can children stay physically active and engage in other recreation activities. Fun, how do we make sure that we have activities that kids enjoy participating in? Friends, make sure that our kids have connections with childhood friends and it's established with their peers. And then future, what are the parents and the child's expectations and their dreams for the future? And I would also like to propose that as adults, that framework really isn't that different, right? And as PTs, we want to help you live the most active, full life that you can. So let's work together to do this and learn those 5 takeaways. Here are the 5 takeaways I'm going to give to you today. First, move, but safety always needs to come first. And that, hopefully, we can help you to figure that out. Number 2 is stay up to date. Number 3, form a relationship with a PT you can trust. 4, know your resources. 5, gather data. So, in terms of move, as I mentioned before, it's really a situation of use it or lose it in terms of our strength, our endurance, our flexibility, and our balance. If you go sort through the sources, there's a lot of data out there that tell us that exercise is really great for us. It helps to increase our mobility, our independence, our overall well being. Um, and that's certainly true. And when you try to dive into the literature, as you can see, if you try to dive into the literature specifically for CMT, it's tough to come by. And that likely is because it's really tough to make it generalized to everybody with CMT because each person is so very different. But overall, the data does suggest that certain forms of exercise may be effective tools for improving components of health and fitness. So if you can get yourself involved in a program that incorporates strength, maybe such as something like Pilates or bar, endurance, it can be as simple as walking around your neighborhood, going for a hike. Maybe you're someone who likes to swim. Stretching to maintain that flexibility. Maybe it looks like yoga or balance. A lot of evidence out there in terms of Tai Chi and how that is helping people's balance and the martial arts in general. Number 2, stay up to date. If you have vision needs, make sure we're talking to the vision doctor. Make sure we're filling in our primary care on all the medications that we're taking. And if there's any interactions, having those be evaluated. Follow up on those annual healthcare visits, vaccine updates, those sorts of things. Because overall, the more our healthcare team is able to work together, the better off all of these things are going to be. Number 3, form a positive relationship with a PT. I would even say consider scheduling a tune-up visit annually. So you are up to date with, what are the safe exercises for you to do? Are there any new programs in the area that might be helpful for you to be a part of? I hope that you'll learn, again, how CMT impacts you specifically and how that impacts your balance in all the environments we talked about earlier, your home, your occupational environments, your recreational environments. And this PT will help you sort through challenges. We will listen to your story and set up goals if appropriate. We will assess your balance and help come up with a care plan moving forward. My number 4 is know your resources. If you're listening today, you know what an amazing resource the CMTA is for all of us impacted by CMT. I really like how it says accelerating research and empowering patients because, my gosh, when you go through this site, there's so much information put in by families who have CMT. There's branch information to help you get connected. There's Facebook links for, young professionals and children. And it's just such a great resource for all of us to take advantage of. There's webinars, and I could go on and on. Anyway, other resources to know that are out there, the Muscular Dystrophy Association, in terms of research and support. There's the Challenged Athletes Foundation in terms of supporting your athletic endeavors. There's the American Physical Therapy Association, which on a professional level and a personal level has been important to me in terms of finding people who can help develop my professional knowledge. But for the person out there in the community who's looking for a PT, there's resources there too. So definitely take advantage of that. The last takeaway, gather data and know your story. That said, when you can articulate your story to healthcare professionals, they have a better idea of how to help you. So keep notes, identify patterns or trends with providers that you're working with, and this will be helpful to put together the whole story. So my 5 takeaways, keep moving or start moving safely, stay up to date, form a relationship with a PT you can trust, know your resources, gather data, and know your story. Any questions?
Thank you so much, Amy. That was absolutely fascinating. There are a string of questions in the Q&A, but unfortunately we're already 5 minutes over time. So I'm not going to be able to feed the questions live, but how would you feel if we'll save all these questions? Can we send them through to you? And what we might do, if you're happy to, is just publish a little Q&A article where you answer some of those questions. Is that okay?
Yes, yes.
That would be wonderful. I know I'll get in ever so much trouble from Laurel if I don't give everybody just a 5-minute break before the next session starts.
Absolutely.
So thank you so much. That was absolutely fascinating. Thank you to everyone who's been here. We had up to 180 people in the session at one point, so you had a big audience. Lots of hearts and claps are coming through on the feedback, so thank you, everybody. The next session starts at 12. And you have choices between CMT surgery with Dr. Glenn Pfeffer or CMT bracing and AFOs. So if everybody wants to navigate back to the lounge, you can have a couple of minutes chat at one of the tables in the lounge, and then you can go off and head into your next session. Thank you again, Amy, and we will make sure we share the questions with you. So thank you, everyone. Bye-bye.
Thank you, everyone.